Cataract is a common condition that over time can often affect your vision. You may notice blurriness, poor night vision, or glare that gradually becomes worse if the cataracts are not removed. Fortunately, cataract surgery can be performed to help restore your vision. If your doctor has told you that you have a cataract, together you are the only ones who can decide if or when you should have surgery to remove the cataract. You will both make this decision based on your own vision needs, as well as any other medical considerations. When you talk with your doctor about cataract surgery, you should take as much time as you wish to make your decision before signing the informed consent forms. Just remember, as with any surgical procedure, you should have your questions answered before agreeing to have the surgery. Now, let's discuss some of the important things you should understand about cataract surgery. Usually, cataract removal is only recommended when you find it's becoming more difficult to do things like drive, read, or recognize people at a distance. As your cataract develops, you may find that adjusting your eyeglass or contact lens prescription may be all that's needed for adequate vision. It's important to remember that your eye's own natural lens, even with a slight cataract, has some distinct advantages over any man-made lens. Cataract surgery means that the cloudy natural lens of your eye is removed during an operation. The most common way of restoring vision after removing a cataract is to permanently implant a small artificial lens in the eye, called an intraocular lens. In most cases, the new lens is implanted during the cataract surgery. In rare cases, during surgery your doctor may discover a condition that could adversely affect the outcome of your surgery. If so, he or she may decide not to insert the lens implant at that time. If this is the case, your doctor will talk with you about further options. It's important to understand that while cataract surgery and calculations for lens implants are precise, they are not an exact science. To get your best vision after cataract surgery, you might also need to wear eyeglasses or contact lenses. In rare cases, an additional procedure may be helpful. Cataract surgery is a common procedure performed on millions of people each year. But as with any surgery, there are risks associated with cataract removal. Let's talk about these risks. As a result of the surgery or local anesthesia injections around the eye, it's uncommon but possible that your vision could be made worse. Complications could occur days, weeks, months, or even years later. Complications may include bleeding in the eye, infection, or elevated pressure in the eye called glaucoma. The retina could detach or swell, or the cornea could become cloudy. There's also a risk of having pieces of the cataract remain in the eye, or having the eye perforated. And there is a risk of having double vision, droopy eyelid, or an uncomfortable or painful eye. Having an artificial lens implanted in your eye carries its own risks. Complications could develop during surgery, or they could develop weeks, months, or even years later. Problems may include dislocation of the lens, increased night glare or halo, inflammation, or clouding of the cornea. There could be bleeding in the eye or elevated pressure in the eye. There is also the risk of seeing double or ghost images, or having thinning of the iris. In rare instances, lens power measurements may give results that significantly vary from what was intended, resulting in the need for corrective lenses or surgical replacement of the intraocular lens. While the outcome of the vast majority of cataract surgeries is very good, it's important to remember that the results of any type of surgery cannot be guaranteed. You may need additional treatment and/or surgery after having cataract surgery. Although it's impossible for your doctor to inform you of every potential complication that may occur with cataract surgery, he or she will aim to answer all your questions to your satisfaction.